go. Well, good afternoon, everyone, and thank you so much for having me today. My name is Joe Neguse. I'm proud to be the representative for Colorado's 2nd Congressional District, which includes Larimer County, so of course here we are. Just by a show of hands, how many folks here are from Larimer County? All right, great. And how many people from Weld County? All right, so all of you are welcome to move to Larimer County. We'd love to have you as constituents in the 2nd District, but to those who raise their hands from Larimer, it's an honor and a privilege to be able to represent you in the United States Congress. I want to thank the North Colorado Health Alliance, the Mental Health and Substance Abuse Alliance, and the Health District of Northern Larimer County for your incredible work and your service meeting the healthcare needs of our community for decades. And I want to thank each and every one of you in this room gathered here today for the work that you do each and every day. And I know that you touch immeasurable lives across our state as we all collectively work to address addiction in our community. And I hope you know how much your federal representatives appreciate it. And I want to thank the hosts for hosting this conversation and for inviting me today to participate in them. In my view, and I suspect many of you may agree, awareness really is the key to solving this crisis. And so hearing stories, speaking with the scientists and the healthcare professionals to more fully understand this issue is just so important, in particular for policymakers like myself. I view our role in Congress is to promote the safety, the prosperity, and the well-being of those, not just in the 2nd District, but of course across the state of Colorado. And it means, to me, working on a number of different issues, the intersectionality of addiction, whether that's lowering the cost of college so that more young people in our community can access higher education, working to increase affordable housing opportunities across the district, working to lower the cost of health care, in particular for communities in the 2nd District where some folks are paying some of the highest premiums in the country. And then, of course, and perhaps most relevant to your work and the work you do each and every day, making sure at the federal level that we make the proper investments in mental health treatment and in suicide prevention. When we begin to battle addiction in our families and in our communities, we have to begin, in my view, by fighting the societal and systemic inequities that are leaving far too many of our fellow citizens in our communities to turn to substance abuse. As I said, all of these issues are intersectional, they are intertwined, which is why it is so important that we look at policy from a comprehensive perspective, that we not lose sight of the importance of providing health care and affordable housing and proper mental health services for everyone in our communities. In Colorado, I know it is no surprise to you all that the abuse and the misuse of prescription drugs is one of our state's major public health crises. And the human and economic cost really is staggering. I know you all know these statistics all too well, but for me, they, I think, are far beyond troubling. In 2017, there were 578 overdose deaths, including opioids in Colorado, a rate of 10 deaths per 100,000. In 2018, an opioid overdose occurred every 16 hours. Those numbers are hard to believe. They really are staggering. And a growing opioid addiction epidemic is one of the primary causes of Colorado's drug crises and must be addressed. And we know that our small towns and rural counties have struggled the most to provide adequate health care for Coloradans suffering from addiction. I would be remiss if I did not say thank you to the folks here from Larimer County who stepped up just last year by ballot measure, I think, in addressing one of the many myriad tangential issues to addiction here in the community, the ballot measure that passed just last fall. And I know the county commissioners are hard at work with many of you in this room in implementing that ballot measure, but I thank you for supporting it. We have to make sure that our medical community, that individuals in this room, all of us working together in order to address this problem, that you all have the resources that you need. And I am grateful that Governor Polis, of whom, of course, I filled his shoes this last election cycle, the very big shoes that he left in the 2nd Congressional District. I'm very glad that he is drawing awareness to this issue. And we're lucky to have him leading our state, in my view, and for his efforts and his cabinet's effort with respect to recognizing this August the prescription opioid misuse and abuse is a public health crisis in Colorado with long-term health consequences, including addiction, overdose, and death, and has ultimately had a profound impact on Colorado's families and communities. I do want you to know that I've only been in Congress for 8 months, so it's been an interesting 8 months acclimating to the craziness that is Washington, D.C., and I'm happy to take questions on that front as well. But I will tell you this, my sense in the Congress thus far is that opioid addiction more broadly speaking, is an issue that members care deeply about. And I think that's in part because each and every one of us has a connection to the issue, whether it's a family member or a friend or someone in our community who has had an experience with addiction. I think it is an issue that people in Congress are taking very seriously. And in particular, I would say the freshman class. I happen to be a member of what's called the Freshman Working Group on Addiction, which is a group of bipartisan, so Republican and Democratic members who are new to Congress, who were just elected in 2018, who decided that this issue would be one of the central issues of our policy portfolio across party lines. Because, of course, this is not a Democratic or Republican issue. It is a human issue, and it is an American issue. The working group has championed a number of different policy items at the federal level over the course of the last 8 months, but one in particular that bears mentioning here is the CARE Act. Some of you might be familiar with it, legislation to provide emergency assistance to areas affected by the opioid epidemic and to make financial assistance for the development, organization, and coordination of more effective and cost-efficient systems for delivery of essential services to individuals with substance use disorders and to their families. It would be a massive investment by the federal government in those services. Not nearly enough, in my view, but it is a start. I also should mention that in the House passed appropriation bills just 2 months ago for 2020. We have increased funding for the Substance Abuse and Mental Health Services Administration. We were just talking about it offline here before my presentation, by $129 million above the 2019, enacted level, and $193 million above the president's budget request. We will see where those numbers ultimately land, but I can tell you that the Freshman Working Group on Addiction fought vociferously to secure that funding level, and we're going to continue that fight when we go back to Washington next week. That funding, as you all know, would include funding for mental health resources for children and for youth, suicide prevention, substance use treatment and prevention, with continued funding for opioid prevention and treatment, and 3 new behavioral health programs to enhance treatment efforts. Fundamentally, we have to understand what families are going through, what law enforcement is going through, what community health professionals like yourselves are going through. A few years ago, before I was elected to Congress, I had the privilege of serving in Governor Hickenlooper's cabinet. I ran the state's Department of Regulatory Agencies. Those of you who are licensed healthcare professionals who know the agency well, please don't blame me if your applications are a little delayed. We certainly did what we could when I was there to try to speed up the licensing, which is a real issue, not just in Larimer and Weld County, but in counties across our state, particularly the Eastern Plains, where there is a big gap in terms of a demand for healthcare professionals like yourselves. But I will just say that some of the most thoughtful and informative conversations that I had during my time at DORA were with individuals like yourselves, with licensed professionals, with people working in the community on addiction each and every day, because while it's easy for us as policymakers to talk about these issues, you all live it. And hearing from those individuals about the way in which communities have been so ravaged by addiction, but also the way in which professionals like yourselves have been able to touch people's lives and help communities recover, to me, was one of the most heartening experiences of serving at DORA. And so I say to you today, as a member of Congress now, that I will certainly be a partner, and I believe that every member of our state's delegation will be too. We may have disagreements about the best way to get there and the best vehicles to support your work, but I do firmly believe, as I said before, that addiction is not a Republican issue. It is not a Democratic issue. It is fundamentally a human issue. And if we appreciate that, and if policymakers can appreciate that, I think we will be well served in helping support your work. So I thank you for the work that you've done. I thank you for the work that I know you'll continue to do in the future. Godspeed, and thank you so much for having me join you today. So thanks again. Thank you. Go. I don't know if are we taking questions? Take a question or two. Sure, yeah, we could take a question or two. Yeah. Questions. This wonderful large room. Yes, ma'am. Yes, sir, I should say. Sorry, because I'm going blind after 8 months of Washington already. Oh, you're reading all these bills, so. Is there any, I couldn't hear that question. Great question. Sorry we didn't have a microphone. So there have been a number of conversations about that. I don't serve on the committee of jurisdiction for that particular issue. It'd be through the Energy and Commerce Committee, but my understanding is that there are a number of different legislators, both Democrats and Republicans, who have proposed doing what you've described. I'm not sure whether or not that's ultimately going to make it through both chambers and to the president's desk. It is intertwined with some of the other conversations that are happening, obviously, at the federal level regarding opioid use and the CDC's new guidelines. And I imagine we could spend the afternoon today talking with you all. It would take a couple hours, if not more, to talk through the various debates that are happening on that front. So, but I think it is something that Congress continues to explore. And to the extent, I guess I would say, that you are passionate about that, or that other folks here are passionate about that, would encourage you to reach out to our office. And it will be something, actually, now that you've brought it up, that I probably bring up at our next freshman working group meeting when I'm back in Washington next month. So, we have time for one more question. Yes? Yeah, it's a great question regarding sort of healthcare reform more broadly, and then parity with respect to mental health services and physical services. So on the healthcare front, I would say, the country is having, I think, a robust debate about what our healthcare system ought to look like at the federal level in the 21st century. And, there are probably 500 people in this room, 500 different opinions about the right approach. I happen to believe that no family should go bankrupt if, God forbid, a loved one gets sick. That's kind of my premise. And any system that builds on the successes that we've had and provides more access and more affordability, more broadly speaking, is something I'm going to be supportive of. And so we've co-sponsored a number of different legislative vehicles that I think would get us there. But what I would say is that debate is a pretty polarizing debate right now, as I'm sure many of you are aware. And I think we ought to spend more time focusing in and zeroing in on the places where we agree. And parity happens to be one of them. This happens to be, irrespective of how you feel about the ACA or about, Medicaid and Medicare. At the end of the day, parity is something that I think most folks across party lines, maybe not most, but a lot of folks across party lines support. And so I'm actually hopeful that, perhaps during this 116th Congress, that could be something that we accomplish. We'll have to see. But I think there are a number of people, again, on both sides of the aisle, who have made the case that we ought to, again, there are immediate steps we can take to improve the existing healthcare system for better outcomes, and obviously with respect to addiction, parity is a great example, right? And there are other, improvements to the ACA for rural areas, by way of example, injecting more competition into the system to help counties where there aren't as many insurance options on the individual exchange. And so any range of things that the Congress could do, and I think should do, to improve the existing system, recognizing the constraints of divided government, of course, that we find ourselves in. Thank you all so much again for having me. Appreciate it.